A reporter, David Batty, this month in The Guardian wrote, neurologic conditions are now the leading cause of ill health worldwide. He noted from migraine to stroke, Parkinson's disease, and dementia are now the leading cause of ill health worldwide, causing 11.1 million deaths in 2021. Now, this is according to a study that was published in the Lancet. And they said the number of people living or dying from disorders of the nervous system has risen dramatically over the past 3 decades, with 43% of the world's population, which is 3.4 billion, affected in 2021. This is an insane figure. Well, anyway, welcome to the Daily Dose. I'm Dr. Mitch, Chief Medical Officer of Hewlett USA. And you're probably saying to yourself, why in the world do we have this problem? Why are we seeing 43% of the world's population somehow affected by neurologic disorders? And I say, look around, take a deep breath, and that should help you figure this out. But let me give you some of the explanations that are out there. The one that's typically given, which I don't buy totally, and that's as the global population ages, the prevalence of neurologic disease is going to increase. Well, that makes sense. As we get older, there's more likelihood of having these diseases, but why? And the key lies in a few key areas, which are lifestyle factors like sitting around, not working out, dietary things, eating fried, fatty foods, tons of sugar. You know that affects the brain. We even call Alzheimer's in some cases a type 3 diabetes. And stress, well, you know that any stress that's ongoing and chronic, which releases tons of cortisol into the body, is going to have effect. They even found once, and don't quote me where I saw this article, but it was there, that even a 5 or 10 minute argument with a spouse, a boss, with a kid, with anybody, a friend, can literally stop the capability of the brain to repair itself for several hours. That makes sense, and certainly lends itself, as stress does in cortisol levels, to something else that we'll come to in a minute that, no question, is increasing these neurologic problems. Sleep disturbances, people not sleeping well from stress or for whatever, or taking medications that may be interfering, are also creating this difficulty. Now, it doesn't take much to take that deep breath, as I said earlier, look around, because environmental toxins like toxic metals, which are literally everywhere, pesticides, insecticides, fungicides, rodenticides, we're getting blasted with these. Isn't it going to do damage to tissue, to our mitochondria, to our health? Of course it is. It doesn't take anyone to tell you that. It just takes one to say, hey, look. And there are some neurologic diseases that may have a genetic component. There are certain people that are prone, but for the most part, it's not. Now, I said earlier that chronic stress is a problem. If you look at the people that get cancer, people that get heart disease, the ones that are chronically stressed do the worst. There are studies that even show that people that are chronically stressed have 30 times the amount of metastasis of a cancer. So there's something about this ongoing stress. Now, stress comes in a couple forms. It comes in what we talked about earlier, the toxins, the toxic metals, and these other types of things, which we do have to figure out how to remove by different methods. But also, what happens is that chronic stress causes inflammation. If you were thinking that, give yourself an A+ today, because chronic inflammation is the cause and nidus for so many different diseases. When cells are constantly inflamed, they try to fix themselves. The body always tries to find a mechanism to help itself, but often the mechanism is not helpful, and over a long period of time, it does cause problems. Acutely, inflammation is needed. Without it, if you banged your arm or you hurt yourself or cut yourself, the body would not heal. But long term, greater than a month or 4 months or a year or longer, these stressors are causing problems, and they will cause problems in your brain. I give you a simple example. When you're uptight and you're nervous, You can't think of the words to say to that person when you're angry or upset, or before a test and you're anxious and you can't think of what it was you were going to say. Well, when you put all these concepts together, especially the toxic and the inflammatory, yes, some genetic, yes, population getting older, it makes sense why an article and a good journal like JAMA is reporting such a marked increase in neurologic disorders. And there are other articles clearly stating it's happening in the younger population more and more. Why? Like I started, take a deep breath, look around, be cognizant of what you eat, what you breathe, what medications you take, what personal grooming things you put on your body, because all of that will contribute to neurologic consequences the longer and further that you use them, and the more stress that you're under over time. Thank you so much for watching. For the Daily Dose, Hugh Light USA, I'm the Chief Medical Officer. I'm Dr. Mitch. For more of this type of content, please follow us or ring that bell below, because we have so much interesting things coming more your way.